were fortunate to provide the first KAMRA Inlay surgeries in Broward County earlier this year. And I was very fortunate and honored to participate in implanting the KAMRA Inlay in the first set of patients, and they have all done extraordinarily well. And we're very pleased with the technology and the results. So the KAMRA Corneal Inlay is a very small device, about 3.5 millimeters, extremely thin, 6 microns, 6/1000ths of a millimeter, disc with a hole in it that we call an aperture. And the way this works is through an optical phenomenon called a pinhole effect that only allows certain light rays through, light rays that don't need to be focused. So the end result of the KAMRA Inlay implanted in the cornea is that the individual can see far, intermediate, and near without any correction. Performed using a special laser that makes a very deep pocket in the cornea, a special tunnel that we manually place the inlay, center it appropriately over the point that the patient sees through. So it's a very simple procedure. In some of our KAMRA patients, we combine it with LASIK if they need glasses for distance, and we may do LASIK on one eye, the eye that we're doing the KAMRA, or we may do it on both eyes to sharpen the distance vision in the other eye. So we only do the KAMRA Inlay on the reading eye, usually the non-dominant eye, and then we'll make sure the distance vision in the other eye is maximal, and that combination of a good sharp distance vision eye and the KAMRA eye, which is allowing vision at all ranges, works really well for providing good, clear vision at distance and up close with both eyes open. So the KAMRA Inlay is designed for people who require reading glasses to see up close. So generally, most appropriately between the ages of 45 and 60. So anyone who benefits, or rather requires reading glasses, would benefit from the KAMRA Inlay. Basically similar to those with LASIK. We want to make sure we have a healthy patient, healthy eyes. We do have some issues potentially with dry eye, and we'll treat that sometimes before, many times after the procedure. The nice thing about the KAMRA Inlay is if it doesn't work well, or if there are any issues, the inlay can always be removed, and it's a very simple, easy process. So if that's the case, and it's fortunately very rare that we have to do that, if we have to remove it, the patient can go back to wearing reading glasses, contacts, or even have kind of a monovision type LASIK to improve their up-close vision. So the fact is the KAMRA Inlay, in addition to its wonders in providing a full range of vision in the eye, is also easily reversible, one of the great benefits of it. So one of the most frustrating times in people's lives visually is when they get into their 40s usually, and they start to require glasses for up close. Sometimes they've never had to wear glasses for anything. Other times they've worn glasses or contacts or had something like LASIK surgery when they were younger to sharpen their distance, and now all of a sudden they need reading correction. So the KAMRA Inlay is wonderful in these circumstances, and there are other options for surgical correction of reading vision issues, primarily something called monovision, where we make one eye sharp for distance, the other eye sharp for up close. The concerns with monovision is that the up close eye doesn't see well in distance. The distance vision with both eyes open is sometimes not quite as sharp as it was before the surgery. And then also it's not easily reversible. The benefits of the KAMRA are that the KAMRA with both eyes open should have no drop or degradation in distance vision, also providing good up-close vision, and that it's fact that it's easily reversible, and also because it's correcting via a small pinhole, it doesn't matter that the reading vision issue will tend to get worse as we get older. So in other words, if with monovision or contacts or glasses, people frequently have to change their prescription as they go from 45 to 55 to 60 and older. But with the KAMRA, because it's a pinhole approach, aperture, that doesn't matter. The amount of reading vision correction doesn't matter at all. So it actually provides protection, and a successful KAMRA patient generally doesn't need to expect to have any additional surgery to improve their reading vision as they get older. So it's much. So of course the best way to learn about the KAMRA Inlay and whether it's appropriate for you is to call CorrectVision and come in for a free consultation.